The way in which the body flow apparatus works is by stimulating a part of the lymphatic system called the lymphangion. Now, the lymphangion is the structural and functional unit of the lymphatic system. And what we have to do is try to get it functioning optimally. And sometimes in all of our bodies right now, sitting around doing nothing, our lymphatic system and our lymphangion is just pumping ever so slowly like this. And unfortunately, in conditions where we put an increased load on our lymphatic system, sometimes that lymphangion just keeps on pumping slow, when in fact it should start to pump quicker and quicker. So what we could see, given our understanding of the lymphangion, that is, it requires neurogenic and myogenic stimulation, we could see a role for the electrical stimulation of the lymphatic system. And of course, that's where the body flow technique comes in, because if we get everything right in terms of the settings on the machine to optimally stimulate our lymphatic system, we can make it flow better. We can make it take away a lot more of those waste products, the toxins from the tissues, and therefore get a better outcome for the patient. It's not one size fits all, and that is so for every single form of treatment that we come across. And what we have to do is have a therapist which is aware of this, and a therapist which is prepared to listen to what the patient says about the impact of maybe their first or second treatment, and then modify that within a certain range of guidelines to try and achieve a good patient outcome. And in a condition such as lymphedema, which is very much a chronic condition, a progressive chronic condition, that interaction between the health professional and the client is really important. The other thing that's very important also in chronic disease management or a chronic condition management like lymphedema is that we have to acknowledge that if we can halt the progression of that chronic disorder, in other words, today is that patient's worst day, that's absolutely phenomenal. And we sometimes don't value that enough. What we always look for is huge reductions and huge improvements. We can get that, and we must value that even more, but what we have to do is acknowledge that if we've stopped the progression of a chronic disorder like secondary lymphedema, we've made a big win in the battle. Because we recognise in all situations in the Australian healthcare system and perhaps internationally that a patient can't see their therapist as often as they should. And so anyone who can actually self-manage or have their partner or their carer help in their management in the home environment certainly may get better outcomes. And some results in other areas where patients have been monitoring themselves and monitoring the impact of self-massage and other lymphatic stimulatory strategies, they've been able to show that they've been able to get much better results. In other words, the therapist results are improved in between therapist visits. Obviously, in all trials, because the group is somewhat heterogeneous, we get a variety of results. Some patients actually responded excellently, and some got a 1 or 2 litre removal of fluid, and we've shown those in case studies. Other patients got very minimal movement of fluid, and that's because of the individuality of these people, and it's because of the individuality of what we can do to make their lymphatic system work better. But certainly there's some very good results in the trial outcomes. There are some extremely good case results. And we're using these case results to show other individuals what can be expected, because sometimes in a clinical trial you don't see your individual, you see the overall result. And a case study, a case result can be very useful to show what an individual with those certain criteria can expect. The status of lymphedema in Australia today is a very sad situation in that it's underfunded, under-recognised and poorly managed. And I think we've got to realise that there are some situations whereby the Medicare funding of therapists to manage and treat lymphedema is certainly not at an adequate level to achieve optimum outcomes. As well as this, there is a very big issue in terms of recognition of lymphedema, and particularly the recognition of the early stage of lymphedema. As we improve with our diagnostic criteria, we may be able to get treatments such as the body flow program and manual lymphatic drainage and all those others in earlier, so we don't have to see the patient going through a whole series of progression of pathologies. The most important thing about the body flow technique is that it works best in the early stage of lymphedema. If lymphedema is allowed to progress and moves to the fatty stage and eventually to the fibrous stage, we can't expect as good an outcome, simply because if a lymphatic vessel is entrapped within fibre, you can't make it pulsate, you can't make it contract, no matter what. So the key point there, I guess, is early detection, early intervention, better outcomes.